Okay.
Good to see you.
Good to see us all. Okay. Yes, hi everyone. I am Alan Odongo from Uganda, and I'm going to be sharing with us about my career journey and the impact I got from Alliance. First of all, I want to start by saying thank you so much to our dear mentors and Dr. Deborah for the opportunity that you've granted us all to belong to this great family, great professional family where we have been impacted a lot. Yeah, moving right away, I am an alumnus of cohort 2024-2025. That is where we started the journey from August, and finished in August of 2025. I'm going to move us a little bit faster. This is my journey. At the moment, I've just enrolled for my master's in public health at Makerere University. And a great inspiration for this actually came from Alliance class, having had a lot of mentors speak and a lot of people who are into preventive medicine. I picked a lot of interest and was able to put a passion together and get that courage to apply. And I got enrolled. We are currently in year one of the study. 2024 is when I finished my BDS. That's just last year. Last year, I finished my Bachelor's of Dental Surgery. And then in that same 2024, I enrolled for the 8-month course with Alliance. It was such a journey that I'm going to talk much about it as we move forward. Maybe also I can highlight on, first of all, before enrolling for this, I did a public health dentistry, higher diploma, that was in 2017, and I finished it, which gave me a background, so much background on preventive medicine, on oral health. Okay, I think we can start from here. We can start from here as far as Alliance is concerned. One would ask, how was the overall experience with Alliance? How was the overall experience? So in summary, I would say my overall experience was very interesting. It was quite an interesting experience. Learning from the best, we had an opportunity to interact with many across the globe, different high-profile people from different places of the world. And one particular one, I think, was a practicing doctor from Mexico. I'm trying to forget about his name, but his presentation was quite impactful in my life. As he was taking us through the impact he was causing in that community through the school outreaches, I was able to draw a lot of similarity with what I was really going through here in Uganda. Because from the very foundation of my practice, I got quite a lot of exposure on outreaches. And all through, we have been trying to reach out schools, reach out community, which have been very hard to reach. And one particular one has been in a place called Dino. This is a community that has suffered a lot of civil uprising and quite remote, lacking a lot of services. When you see the service inequality in the place, it's quite pathetic. So when we reach out to that community, we always reach out at least 2 times in a year. We reach out to that community, giving them oral health curative and then preventive services. And that is what we have been doing for the past 5 years. Also, one thing that I would want to highlight as far as my experience at Alliance is concerned is my understanding of oral health. My understanding of oral health quite broadened. It quite broadened. I mean, at school, you basically learn about there's a leaning towards clinical practice. But then by this class, I was able to get another understanding of dentistry beyond the clinical practice. That's where we look at preventive. How best can we prevent this condition which has lasted for several years? What can we do about it? And what impact can an individual put in as far as dealing with the oral health is concerned? I got a different perspective on that line. And at the moment now, I am able at least to come up with a project, put a project in a community, and evaluate the impact of the project. All this has been courtesy of the training that we got from Alliance through the mentorship of different mentors that we had. I am trying to move a little bit fast. I don't know how many minutes I have. I joined a little bit late, and I have no idea how many minutes
Yeah, just move along, and the next we'll go to Vermont, Dr. Wandera. But I want to thank you for your comments so far, and just share with you, I have an update when you're done about Dr. Jaime Edelson from Mexico. After you finish speaking. So you have about 2 more minutes.
2 more minutes. Okay, so far this is my career journey. Yeah, I am moving from clinical practice to community outreaches, trying to jangle up things. So all those areas I'm always involved. I said about a community outreach where we go 2 times in a year to visit that particular community. And the impact has been so amazing. So amazing. Whenever we reach in that community, you literally see the faces of the people we have impacted, and you feel at heart that what you're doing is making a difference. Giving a range of services, as I said, from oral health education to curative treatment, basically tooth extraction and simple fillings. Yeah, I've also become an advocate for oral health literacy. That is a particular project where I did during my Alliance course training, oral health literacy among the village health teams, a particular group of people here in Uganda that they give services to the community at the grassroots level. And they just volunteer. These are people who are volunteering. They are not paid. I was trying to assess to what extent do they understand oral health, their literacy of oral health. And in the study, I found out that they really have very poor oral health literacy, but they showed a lot of interest in knowing. They are eager to learn and eager to know more about oral health. And that is a direction where we could get partnership and help these people better understand oral health so that their impact at the grassroots could be more impactful. I also have a very strong passion for preventive and pediatric dentistry. Much as I've not taken the line of pediatric dentistry to further the studies, I have studied with a Masters of Public Health. Someone may ask, why pediatric dentistry? But I personally believe that if we put more effort on the children at their young ages, we could probably raise a more orally healthy generation, and the impact can easily be seen. That is why I try to intermarry preventive with pediatric dentistry for a better oral health in the generations to come. Yeah.
Thank you. Thank you. Thank you for sharing the look into your personal goals and your personal continuing accomplishments, of which I am very proud. So
okay, maybe just as I conclude, just an impact and growth opportunity. I looked at it as networking and collaboration is the only way that we can grow and continue to impact. And also along with lifelong learning and unlearning, there are things we may have to learn and some things we'll have to keep unlearning as we go on. And also to stay visionary and practice our leadership with compassion. I believe we can do better in oral health. And quick reflection, only one slide, and then I will be done, Dr. Dave. The lessons and the reflections, probably no one can disagree with this, that mentorship is a real multiplier of potential. And I would want to urge us all to always seek this mentorship, value mentorship, and if possible, let's offer this mentorship where we can. And also leadership in oral health shouldn't just be about titles, but we should aim at delivering services and being really impactful in our communities. The effort may be small, but it matters a lot. And also we should know that growth comes only when we get out of comfort zone. We have to come out of our comfort zone and we get growth. Adaptability and cultural sensitivity. I mean, there are places you go with your skills, but if you can't align to their culture, basically all that you have can't impact anything. So we have to adapt and also be culturally sensitive as we try to impact the community around us. And then in conclusion, I really want to thank Alliance for the seed of purpose that they have really sown in us. And we are hopeful that this seed will grow and continue to be a blessing to the community we live in. And also urge all our members and all our alumni to stay focused, compassionate, and remembering that the future of oral health lies in us, and we have to stand to it. And in conclusion, I'm really grateful, Dr. Deborah, and Jamie. Jamie has been amazing. Every single time you send an email, you almost get instant reply. Quite incredible. Thank you so much. And all the mentors who have mentored us, who have been with us, we are not yet a finished chapter. We are not yet a finished chapter. We are hopeful that the chapter will keep on being written, revised and rewritten time and again. Thank you so much. I would like to end by saying, may the Lord bless us all. And thank you so much.
Alan, that was just inspirational, and maybe even especially for me to hear your words come out of your mouth and see how you got our what we're about and what we need to do. And I'm so proud. I'm so proud. See, a lot of people are clapping. And
Thank you.
I just want to share with you an update of what you, the person that you were talking about, who spoke about what he did as one person in Mexico, Dr. Jaime Edelson. He actually lectured this week for our year. I don't know how many first-year students are there, but I'm in communication with him now, because when I first met him, do you know where this project was? It was just a project in my computer. And I met him at a meeting for like leader development, and I was sitting with him and he was telling me what he was doing, and I kept on pointing to different things in my computer, and I said, well, we're going to do this. It's like, wow. So I just spoke to him after he did his lecture, and I said to him, Jaime, we want to have an ambassador program. That's one thing that I'm looking at developing this year, with different ways you can be an ambassador in your region to bring this kind of approach to your area, pulling a lot of the dentists together, different way of looking at things. And I'm very fortunate. I have an appointment to speak to him in the first week of December, how he can be the chair of our AOHAB ambassador program. So I'm hoping to roll that out as well this year, and I'm very proud of that. And I'm so glad you pointed out that his lecture is very different from everyone else's lecture. But it really just shows how one person can make an incredible impact. And it's a great model to look at. And we're going to be moving forward with that. Next, as our last